Hi, I'm Nick. This is my wife, Bree. This is who I'm going to be doing my physical exam on. So, to start, we're going to start with the head and face. I'm going to inspect for color, temperature, moisture, texture, any swelling, her skin turgor, bruising, scars, any lacerations. So I don't have anything to check her temperature with, but just placing the back of my hand on her skin, she does not feel warmer than usual. Her skin color is appropriate for her ethnicity. She has a little flushing of her cheeks, but I think that's just because she's nervous. No scarring, no bruising. And so after I inspect her skin, I'm going to inspect her head for size, symmetry, and that it's midline with the rest of her body. So just sit up for a second. And then looking at her head, it is symmetrical, it is midline, and it looks like a normal head. You can lay back down. So now what I'm going to do is I'm going to palpate her head and scalp, and I'm going to check for her hair color to make sure that it's uniform all the way through. I'm going to check her hair texture, if she has any lesions on her head, any masses, tenderness or depressions, and the depression is going to check for dehydration. So feeling her scalp, do you feel any tenderness back here?
No.
Okay. I'm going to then palpate her temporal arteries, and this doesn't feel tender, does it?
No.
And then moving on to her lymph nodes, I want you to sit up and put your back kind of over here. So to start, you start with the preauricular, so that's going to be behind the ears, or in front of the ears, sorry. And then you go to the postauricular, which is behind the ears. Occipital, over here a little bit. Occipital, which is going to be up here, next to her occipital protuberance. Then you move down to her submandibular, and then her submental. After that, you go to anterior cervical. So you do one side of this at a time, just so you don't affect the jugular vein. And then posterior cervical. And then her subclavicular. And all of her lymph nodes feel okay. I don't feel any enlargement. After that, then I'm going to test her cranial nerves. So the first one I'm going to do is cranial nerve 5, because that has to do with the head and face. So to inspect that, you go over her mass eater, and I just want you to clench down. All right. And then that was equal on both sides, so I don't expect any cranial nerve damage there. So close your eyes, and then I'm going to test her sensory. So I'm going to use this, and I'm going to test her sensory. Tell me how this feels.
Kind of tickled.
Okay. And then, how does this feel?
The same.
Okay.
Soft.
All right. And then after the soft, then we do a sharp, so I'm going to pinch. So we know that felt the same on both sides. So you do it on the cheeks, you also do it on the forehead, you also do it on the chin and the nose as well. After that, then we check for cranial nerve 7, which is going to be for facial symmetry. So I'm going to ask you to look at me, and I want you to smile. I want you to frown. I want you to grimace.
What's that?
Out here. And then raise your eyebrows. Put them kissy face.
Mwah.
Everything is symmetrical. So I would say that cranial nerve is intact. After that, then we're going to check the ears. I'm going to inspect her outer ear for symmetry and shape, also the position of it to make sure that it's going to be equal with her eyes. And then after that, I don't have an otoscope, so I can't look in her ear, but I have a pen light, so we're going to make do with that. So, here behind the ear, and then that's symmetrical. There's no redness, there's no swelling, there's no drainage coming out of her ear. That's good. And then to check, if you have an otoscope, you would pull her pinna back and up, and then look in, and you would look, this is her right side, so you would inspect the light flare to be at 7 o'clock. You would also expect for her eardrum to be a little pearly gray with no fluid or whitening behind it, or redness. And then the same thing with this side, you pull up, and then the light reflex on this side should be at about 5 o'clock. Yeah, 5 o'clock. So then after you check all that, then you're going to check for cranial nerve 8, which has to do with the ears. And so first you perform the whisper test, and that's when you stand behind them and you kind of just whisper. So I want you to close your eyes and tell me what I say when I whisper at you. I think I'll word to whisper to you. Okay.
Couch.
So she passed the whisper test, and then after that, if you had a tuning fork, you could do the Weber test and the Renee's test. The Weber test is when you hit the tuning fork, you place it on the top of the head, and you ask her if she feels it the same on both sides. And if she does feel it the same on both sides, then that means there's no conduction issues going there, either with bone or air conduction. Renee's test is kind of similar, but you would hit the tuning fork, you would place it on the side of her head, on the mastoid bone, and then you would ask for her to tell you when she stops feeling it, and then once she stops feeling it, you place it in front of the ear, and then tell her when she stops hearing it. If she can't hear it, that means that there's going to be an air conduction issue with in front. But if it was on the bone and she could not feel it on her bone, then that would be a bone conduction issue, and that would also be bilateral on the same side as well. So in her eyes, now I can get in front of you. So with her eyes, you're going to inspect her lashes, her brows, and any palpable fissures. So looking at her eyes are both symmetrical. Her eyebrows are unilateral or bilateral, and her palpebral fissures are in the same place on both sides, so they're symmetrical as well. Also going to inspect the sclera for any color lesions or discharge. And then this is also going to check for cranial nerve, 3, when you check for the pupil reflex. And both of her pupils are reactive. There's no redness in her eyes, there's no drainage, there's no swelling. She has no signs of infection as like pink eye or anything. So after that, then you're going to check for accommodation and convergence. So you take the pen light and just tell her to kind of follow it. So I want you to look at the tip of it and then just follow it. And then she definitely had some accommodation there. So that is going to be a normal sign. And then also you're going to check for peripheral and central vision. So I'm going to tell her to look at this and tell me when she can stop seeing it. Keep your eyes straight.
still see it. Is this normal? I can still see it.
Yes.
Okay. I can't see it.
And then on the other side. Cool.
I can't see it.
Okay. So that's test for cranial nerve 2. So then also what you're going to do is the test for cranial nerve 3, 4, and 6. And so that's when you do the wagon wheel. I want you to look up. And that was also well. So if I had an ophthalmoscope, I would check for her red reflex. I'm not even on the screen. Her red reflex and other internal eye structures. So then you would check to see if there was any cool wool cotton spots, if I could speak. You also check her optic disc and everything around there. So next you check the nose. You would check for nose midline and make sure it's straight and her nose is straight and symmetrical. Her nasal patency, so I want you to look straight up. And she does have a little deviated septum, which can be hereditary. But she does have good nasal patency. She has a little redness at the top, but she just worked out earlier, so could be a little bit of that. You also check for sinuses also when you're looking at the nose. And so you can either palpate those, or you can also hold a pen light onto them. So this would be your frontal. And they're translucent, which means she has no sinus issue there. Or maxillary, sorry. And then frontal's at the top. After that, you would check her throat and mouth. And so you would look at her lips, her teeth, her gums, everything in the mouth, her oral mucosa, her soft palate, hard palate, tongue, and the floor of her mouth also. So just open up and say ah. And then when looking back here also, her tonsils are not swollen or enlarged. Everything is normal in here. There's no redness. There's no swelling. Well, she has no tonsils, so that would be why there's nothing there. I always forget you don't have tonsils. So looking at her tongue's midline. There's no swelling. There's nothing wrong there. So to check for cranial nerve 9 and 10, I would ask her to raise her tongue up and then stick it out some. And then just, good. And her cranial nerves there are normal. So when inspecting the neck, again, you're going to check for the color, the temperature, if there's any swelling, the moisture of her skin, the texture, the tartar, the bruising, the scars, and if there's any lesions. So when looking at her neck, I don't see any of that. Her skin looks moist, her skin looks warm, there's no redness, there's no swelling, there's no scarring on either sides of her neck. She does have some white discolorations, but that's because she has tangy versicolor, so that is expected. So after that, then I'm going to check to see if her trachea is midline, which it is. I'll just look straight up. Her trachea is midline. You can notice that she has good muscular symmetry on both sides. So now I'm going to palpate her thyroid gland and her carotid arteries. So when you palpate the thyroid, you want to do kind of one side at a time. So just look a little bit. Your thyroid is going to be right here. It's not enlarged on this side. And then to check for her carotid, at the same time you can do that. And that's a strong pulse on that side. Then you move over to this side, and you also check the thyroid over here as well. And again, on this side, there's no swelling or anything. It's not warm. And then check her carotid pulse. And then also with the carotid pulse, you can check for her bruit. So go ahead and do that. And check this on both sides. And there's no bruise on either side. After that, then you check the range of motion of her head, so flexion, extension, lateral flexion, and rotation, and then you also check it with resistance as well. So turn your head to the left like that.
To the left?
Mm-hmm. And then to the right. And then look straight back.
What do you mean?
Up. Straight back. And then touch your chin to your chest. And look straight back. And then I want you to push your head towards my hand. Okay. And then other side. Okay. And then move forward. Okay. And then move your head back. Alright. And she has good strength in her neck. So then after that you test cranial nerve 11 going down, so I want you just to shrug your shoulders. And then there was no resistance on either side, so her cranial nerve 11 is intact. And then after this, you would move to the chest aspect, but I'll ask her if she feels comfortable with me doing her chest on camera.
I found it.
Okay. So with her chest, you would check for the, again, the color, temperature, moisture, any skin turgor, any swelling.
Wait, do I have to lift up my shirt?
I'll just pull it down. Also, while you're looking at the chest, you're going to check for any respiratory problems and see if she's using any of her accessory muscles to breathe, which she is not. She's breathing pretty normally. It doesn't look like she's trying to breathe. It just looks normal. Also, with breathing, you would check for any nasal flaring to see if she's trying to breathe, or any cyanosis on her chest. So, pulling down, chest looks normal on both sides. There's no redness, there's nothing like that. Rotate your skin. And there's no tinting of the skin. So she's good. Again, she has some discoloration, but that's because of the tinting of her color that she has. So after that, then you would check for any obvious deformities or symmetry. So you'd like a bird chest or a barrel chest, which she does not have either one of those. Her chest is symmetrical on both sides and flat. So now I'm going to ask you to just kind of like sit up a little bit. So when doing this, when sitting up, you're going to palpate our already palpated symmetrical chest expansion. So now I can kind of percuss over her lung fields to make sure that there's no like internal swelling or bleeding or anything. So to do that, you kind of just hit on the ribs going down. Not like that, sorry, messed that part up. And that all sounds like it's going to be kind of hard. So then after that, I'm going to listen to her lungs. So then just going down the list, or where the lungs are.
Take a deep breath.
And then kind of lean forward a little bit and go on her back. Deep breath. And with her lung sounds, they all sound normal. There's no wheezing, there's no crackling. There's nothing like that. They all sound clear. So after that, then you check for conduction. And so I'm going to, again, listen to her lung sounds, but I'm going to ask her to say the letter E every time I place. So every time I go down, just I want you to say the letter E, okay?
E. 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 E.
And it sounded like she said the letter E, which is normal. If it were to sound like she was saying the letter A, then that could be a conduction issue as well. You can do bronchophony as well, and so that's kind of the same thing, but when you go down, you're going to have her say the number 99. So I want you to say, and this one you do with your hand. So say 99.
99. 99. 99. 99.
And there was vibration all the way down with that one. So I already checked her anterior chest, so now I can check posterior chest, so it's kind of like her back with the same things we checked earlier. So the color, temperature, moisture, skin turgor, any edema, or lesions, scarring, anything. And on her back, again, there's that discoloration from the tinea versicolor that she has. The skin looks good. There's no redness or anything. No deformities. Nothing wrong there. So now we move on to her heart. With her heart, I'm going to listen to all of the lung sounds. So the aortic, the pulmonary, the Erb's point, tricuspid, and mitral. Move your hair back. So right here is where we're going to have the aortic sound. Pulmonary. Erb's point, which is right in the middle. And tricuspid. And then mitral or apical. And here you would listen for a full minute. So I'll do that now. I got 74 beats per minute on our apical pulse. So now I'm going to have you lie down on your back. So when she was doing that, you would check to see if she was heaving or lifting while doing that, and she was not. And so now you listen for any thrills over the auscultation points of her heart. So again, the aortic, pulmonary, Erb's point, tricuspid, and mitral. And she has no thrills over any of those either. She also has no jugular distension. Even when she was sitting up, looking at her neck, there was no distension. So now I want you to turn on your left side, and I'm going to listen for a murmur also.
Is this okay?
Yep, that's okay. And I hear no murmur or anything there. You can turn back on your back. You can audibly hear S1 and S2 as well. There's no ventricular gallop or murmur or anything wrong with her heart sounds normal. So now with her abdomen, pick your shirt up. Just kind of look at your tummy. So looking at her abdomen, you're going to check for any, the color of it, the bruising, the temperature, the skin turgor of it, if there's any discomfort in any spots, scarring, which she has 2 scars right there. She has 2 scars kind of in the midline. She also has her belly button pierced as well. Do you have any tenderness in your stomach?
No.
So going down her stomach, it is symmetrical on both sides with even contours. So then you listen to her aorta and the renal arteries, iliac, and you can feel the femoral arteries as well going down. So to kind of listen to her arteries here, you're kind of doing a double where you're inspecting and auscultating at the same time to where you're listening to bowel sounds as well. Right. And then when listening to vowel sounds, you start in the lower. And if you don't hear any, you're supposed to listen for 10 full minutes, but I'm hearing them, so. And then after that, you can percuss all of the four quadrants for tympani or dullness or flatness. So start in the top where her liver is. On the other side, spleen. They all sound pretty tympanic. So after that, then you palpate for any abdominal tenderness, and she already told us that she does not feel any tenderness. So I'm going to start in the upper part. Move over. If you feel any discomfort, tell me. And then you move over to the appendix where McBurney's point can kind of be for open heart. Okay. So she has no discomfort or anything there, which is good because that could indicate appendicitis. I felt no masses. She wasn't tender. So now palpating her liver and her spleen. So liver, kind of take a deep breath and then push up. Okay. And then same thing. And breathe out. And her liver and her spleen both don't have any enlargement to them. So you can sit up now. So now I'm going to use your hand. I'm going to inspect your hand just to make sure there's no redness, swelling, any deformities, any tenderness, any crepitus. Make sure there's some symmetrical, and there's no nodules on her hands. I'm kind of feeling down. Doesn't feel sore to you. And then I can't really check her capillary refill because her nails are painted. Can't check on her toes either because her toes are painted as well. You can check her radial pulses though, so kind of flip your arm over. And that one in that as well. As well as I'm checking this, I'm also looking at her skin color, the warmth of her skin, the integrity of her extremities, and that her wrists are not swelling any. So then after that, you can check for range of motion of her fingers. And so I want you to pick your hands up like that. That's flexion. And go down. Oh, that's extension. This is flexion of her hands. And then put your wrist back. And down. Right. And then put your hands back up. There you go. And then push your hands forward towards mine. Okay. And then push them back. Alright. And then that was checking the musculoskeletal as well, and that was good. So grab my fingers, kind of cross your hands, and then squeeze. Alright. And that is checking the hand grip of her hands, and they're both equal on both sides. So with her wrists as well, there was no redness or swelling or deformities on her wrists. She had nodules, no crepitus when I was feeling her hands and her wrists. And they're both symmetrical. The range of motion of her wrists as well, when I checked the musculoskeletal part of that, was good. She was able to go back and forth against resistance and able to do it on her own as well. So now we can move on to her elbows. So just pick your elbows up like that. And look, and they're both symmetrical. There's no redness, there's no scarring. There's no deformities on there. Let me see your arm. And I'm going to check for any tenderness or internal nodules. I can feel it. That's not tender.
No.
On the other side. Not tender either.
It's not tender.
Okay. There was no crepitus either when she was moving. I couldn't hear or feel it while she moved. And then go like this. Come up. And come down. Yep. And then her flexion and extension is also okay. And then we're going to do the same thing against resistance. So go like this, kind of like a curl. And then I want you to pull towards yourself. Okay. And then push towards me. Okay. She was able to do both of those towards resistance. As well. So then I can look at her shoulders. So I'll do one shoulder at a time. And again, there you're looking for redness, swelling, any deformities or any crepitus. So just kind of looking. Yeah, that works. There's no redness. There's no swelling. Kind of move your arm back and forth, kind of. And there's no crepitus there on this side. Again, I'll do it on the other side. She has a little bit of creaking on the side, but nothing that I would be concerned about. So range of motion with her elbows, you can flex and extend them. So just go straight up and then straight back.
Did you mean shoulders?
Straight up, straight back. And then if you can, just kind of like stand up and do a circle. Or lean forward and do a circle with your arm on both sides. Okay. And she has full range of motion on both sides. With her shoulders. So next we can move on, and she can internally rotate, externally rotate, abduct and adduct her arms. So with abduction and adduction, just kind of go out like a bird, and then come back. And that was abduct and adduct of her shoulders. So she has full range of motion with her shoulders, wrists, and elbows and fingers. So close your eyes, and I can do a light sensation to the back of your arms, and just tell me kind of what you feel. I can do a light and a hard.
Sorry, I'm not sure.
My Alexa decided to go off. So close your eyes and just tell me what you feel.
It's like soft.
And on the other side. Does it feel the same on both sides?
Yes. You're tickling me.
Alright, pinch.
Oh.
So it obviously felt the same on both sides. So if I had a little hammer to check her deep tendon reflexes, I would, but to check for him, you can check brachioradialis, which is basically just holding the hand out like this, and you would tap right along her radial nerve, and it would cause her arm to jump. You do that on both sides, and again, on this side, you can check her bicep tendon, which you would hold her arm out. And then you kind of hold it up while supporting and tap right there, and it would cause her arm to jump. And then the same thing on this side, about in this area, you would tap. You can check her patellar reflex, so she would sit on the side of on the corner of the couch, and you would tap right along here on her patella. Same thing with her Achilles, and then you could also do Babinski, which I can do. I do have something sharp. I can use this. So, you can check Babinski going like that.
It's ticklish.
And her toes don't flare out, so that was a normal Babinski. So with her lower extremities, you can inspect and palpate on the toes, noting any redness, swelling, discomfort, tenderness, nodules, crevitus, as she's cracking her toes, or any symmetry. So they both look pretty normal. Again, can't check capillary refill because.
Do you want to turn the screen?
Again, you can't check capillary refill because her toenails are polished over and can't really see them on either side because of that, which is okay. When I say it's okay, because her skin is warm, the skin turgor is fine. Her feet are warm, they're not cold, so I know that they're getting perfused. Also, to check for perfusion, you can check her pulses. And so, posterior tibialis, I can feel on both sides. And then you can check her dorsialpedis one too, which should be right around here. This one's always hard to find. And it's right there. And then on the other side as well. Which is right there. I'm popping. So the warmth and the color in the skin turgor of her feet is all normal. Nothing is cool to the touch. Everything is warm. And then you can assess the strength of her knees against resistant, but she's had knee surgeries before, so I don't know if you want me to do that.
You can do it on my left knee.
Okay, I can do it on her left knee. Her right leg had a double meniscus surgery a year ago, and so the sensation in that knee is still coming back, as well as some swelling, but that's because she works out pretty frequently. And today was a jumping day for her.
Yeah, so my knee hurts.
So the strength at the knee against resistance, so you can kind of just sit on the side. Her knee would normally be dangling in an office, but it's not. But you would have her, again, just kind of push up. And you're strong. Okay. And then come back down. Which is obviously strong. And then after that, you can stand. And then I'm going to have you kick your leg out and back. And then again, you can have her hop on one leg just to kind of test the dexterity, but I'm not going to have her do it on the other leg. Just because of that meniscal surgery. So you can go ahead and sit back down. And again, that's also looking. That's also looking at the strength of her hips, to be able to abduct and adduct against on her own, and then against resistance, as well as hopping on one foot. So now I can really kind of look at her hips to make sure there's no redness or swelling or anything. So kind of scoot down. You can do this either standing or sitting. With some people, I prefer, especially if they have leg injuries, to have them lay down. That way it's not putting too much pressure on knees or the hips. But again, you would just kind of look at the hips. You would feel for creases on both sides for the iliac crest on both sides. And that's equal. And again, she has no discomfort there. So there's no redness, there's no swelling, no crepitus with her joints. She has no problems moving or running with it. So I expect that her hips are in good condition. And then again, with her sitting and standing, that has range of motion with her knees. So flip on your back, and I can check your spine. Or flip on your stomach, so I can check your spine. You're on your back. So with her spine while laying down, I'm going to pick your shirt up. You can kind of check to see the curvature of her spine. So if it's straight or if it's curved at all, which going all the way down, there's no curvature. It's pretty aligned. She has no tenderness. With her sitting up and standing, that's also going with flexion and extension of her spine, as well with her normal movements. That's also getting the side movements of her spine. So I don't feel any scoliosis or spinal flexion. She has a little curvature at the top, but that's from when she was born, which I only know because she's my wife. So if that was anybody else, I would ask more details about her spine, as why, or if she was in an injury before, if she had any spinal surgery, or if this is a birth defect. But again, her spine is pretty straight all the way down, just with a little curvature at the top. With her back, on the lower end, she also does have that tenebrous color down here as well. But there's no swelling, there's no redness. She's not tender, which isn't good. So I want you to stand up now. And this is when we can do Romberg test. So I want you to stand like that, close your eyes, and hold your arms out to the side. And put your feet together. And when she does this, we're looking for any abnormal swaying. So either she wouldn't be able to stand like that on her own. Her feet are, can't really see. Her feet are together, so she's not swaying or anything. So you can stop and sit back down. So after that,
I just said you're smart.
After that, you can check her gait, which was there too. So when she got up to walk over there is when I looked at her gait, and she was not swaying or shuffling or anything. She was walking with a regular pattern. But yeah, after that, that's about it. Ask her if she has any questions.
Can we watch The Bachelorette now?
Sure. And that is all.